Hi everybody, it's David Porter, and tonight I want to talk about parasomnias. The parasomnias are sleep disorders. They are psychological, psychiatric disorders, neurological disorders, which are involving the sleep cycle. And here they are. Number one, and they're not in any particular order, but number one is somnambulism, commonly referred to as sleepwalking. People who somnambulate will get up out of their bed and walk around. And they may walk around the house, they may leave the house, they may leave the house in their whatever they're sleeping in, or including a state of undress. Now there are some variations of this which are rather bizarre, and that includes sleep eating. These are cases where people will get up and eat whatever it is they can get their hands on. And they don't always eat food. They will eat almost any object they put in their mouth that they can chew up, that will fit in their mouth and that they can chew. And sleep eating is a documented side effect of the atypical hypnotics, such as Ambien, Lunesta, and Sonata. There is sleep apnea, which is probably the most well-known parasomnia. Sleep apnea involves cessation of respiration during sleep. Normally, when we sleep, or if we're unconscious even, our respiratory process will go on automatic and keep us alive, keep us breathing. Now, with sleep apnea, that the systems designed to keep us breathing when we're not conscious are going to malfunction. There is central sleep apnea, which basically the signals from the brain to the diaphragm are not strong enough or not transmitted, and that causes cessation of respiration while sleeping. There is obstructive sleep apnea, where fatty tissue in the neck, like I've got, unfortunately, or sometimes just the shape of one's tongue and the size of one's throat. It can also be someone who is normal weight, but the bone structure of their face is going to be basically conducive to sleep apnea, and especially when laying on one's back, the airway can be occluded and you could stop breathing. And when this happens, CO2 is going to build up in your blood, in your circulatory system, and this is going to send a signal to a part of the brain called the reticular activating system. And the reticular activating system is going to get an emergency signal. Hey, we stopped breathing. Wake up now. And you're going to wake up and take a very deep breath, suck in some air quickly. Because you will feel like you're smothering, like you can't. Well, it's not that you feel like you can't breathe; that you actually stop breathing for 30 seconds to 1 minute. Now, many people who have sleep apnea will not even recall having woken up sucking air like that, and you may do this many times an hour throughout the night, and it is very, very disruptive to sleep. People with sleep apnea wake up in the morning, depending on the severity of it, wake up in the morning feeling exhausted. They don't feel any better than when they went to sleep. That's because they haven't been asleep. There are also, another parasomnia are nightmares. Not bad dreams, nightmares. There's a very big difference. Bad dreams are dreams which are unpleasant, which typically they involve public embarrassment or some expression of anxiety or discomfort. A nightmare is going to be much more intense. With a nightmare, you will wake from it suddenly and will probably be sweating, breathing very hard, heart pounding. You may cry out in your sleep or upon wakening, or feel disoriented. And typically, as you recall the dream, you'll recall some very terrible images. I mean, things out of a horror movie. Nightmares are very often a symptom of trauma, of post-traumatic stress disorder, although nightmares can also be caused by medication, Certain meds can do it. Anti-malarials, meds designed for prevention of malaria, antifungals, and also withdrawal from alcohol. So nightmares often have a pretty traceable cause. You have RLS, restless leg syndrome. This is described as this creepy, crawly sensation that starts at the soles of your feet, slowly works its way up your calves, and you feel like you want to move your feet, like you want to shake your feet or stomp your feet. And typically it occurs before bedtime or while you're in bed trying to sleep. It tends to disrupt sleep. You have bruxism. Bruxism is jaw grinding, and people with bruxism will involuntarily clench their jaw, grind their teeth. Maybe their teeth will chatter, and you can wake up in the morning with pain right here in the hinge of the jaw, and or pain especially in your back teeth from grinding. You may have a headache or vertigo because it can upset you're clenching your teeth so tight or grinding your jaw so tight that it can cause a disruption in your inner ear, and you can have vertigo that can persist for a few days. You can have accompanied by a headache. You're going to feel like you have a hangover, yet you did not drink alcohol the night before. You have a very odd sleep disorder, which is rare. I've only talked to a handful of people who have experienced it, and that is sleep paralysis with hypnagogic hallucinations. And what this is, you will wake up and feel as though you can't move, like you are paralyzed or restrained, or something is holding you down or sitting on top of you or laying on top of you. You're going to feel like you can't move. And you will typically sense or see some malevolent presence or entity in the room with you. And this can be a very distressing experience. Like I said, some people will never get it in their lifetime. Other people get it once or twice. Other people get it like every night for months at a time, which is going to cause sleep avoidance, fear of falling asleep, which in turn can actually aggravate things, make things worse. So you're going to feel, again, restrained or unable to move and sense this malevolent presence. And there's a lot of folklore around this, that this is a demon or a malevolent spirit. The scientific, and in fact in Celtic Gaelic folklore, it is identified as the old hag or the hag, which is basically a witch woman that attacks men in their sleep. In medieval Europe, there were entities called the incubi and succubi, a demon which could assume either male or female form and would basically sexually assault people in their sleep. Now, the scientific explanation for that is that while we are sleeping and dreaming, our acetylcholine levels are going to bottom out. And the reason for this is acetylcholine is responsible, primarily has two functions, memory and muscle movement. So acetylcholine levels are going to be very, very low, which is going to create, first, when acetylcholine attaches to what are called muscarinic receptors, you're going to have lack of muscle contraction. Your muscles are going to be relaxed. You're still going to be breathing. Your diaphragm is going to work and you're going to breathe. But your skeletal muscle, your voluntary muscle, is not going to be responsive. And this is to keep you from jumping up out of bed while you're dreaming and act out your dream and injure yourself. And when acetylcholine attaches to nicotinic receptors, that is primarily for memory formation. So this is why you do dream every night. We all dream every night. However, we only recall about 20% of our dreams. We may not remember our dreams for a few weeks at a time. And there are people who report they never dream. They do actually, and we can tell this by if they're hooked up in a sleep lab, but they don't recall their dreams. So those are the parasomnias. And then, of course, we have insomnia. And insomnia is basically inability to sleep, either trouble falling asleep, trouble staying asleep, or you wake up too early and can't get back to sleep. What's called either delayed onset, poor maintenance, or early awakening. And you can, of course, have a combination of all three. Insomnia tends to be a symptom of a other psychological or physical disorder rather than a primary sleep disorder. Sometimes the causes are very obvious. You have an injury to your back or your shoulder. Every time you roll over in your sleep, you're gonna feel it. It's gonna wake you up. It's gonna cause problems of maintenance of sleep. Insomnia is a symptom of depression. It is a symptom of anxiety. It's a symptom of trauma. In order to fall asleep, you have to have some degree of a sense of security. And people with PTSD, as I've observed in other videos on my channel, have had their senses of safety and security violently ripped away or gradually eroded. You don't feel safe. It's going to be very hard for you to relax and let go and fall asleep. So, one more. You have hypersomnia. Hypersomnia is excessive sleeping, and again, that is a symptom of depression, and it is also associated with a lot of meds, especially the older antipsychotic medication will produce hypersomnia. So, either insomnia or hypersomnia, there tend to be pretty obvious traceable causes. Or, of course, you're just exhausted, you're overworked, you're sleep deprived, and now it's time to catch up. So, you're going to sleep for 12 or 18 hours instead of the normal 7 to 9 hours. All right. So, those are my thoughts on parasomnias. Thank you for watching. Please hit subscribe. And if you have any topics in psychology, criminology, or substance abuse you're interested in, please post it in the comment section, and if I think it will have mass audience appeal, I will make a video about it. Thank you for watching. Be safe.